Fred Kagonye, KTN News.
Meanwhile, the country is witnessing an acute shortage of rapid antigen testing kits, an issue that is now hampering the war on COVID-19 in the country. According to the Kenya Medical Research Institute, KEMRI, the shortage has affected testing capacity at both public and private facilities across the country. Our Health and Science reporter Chabet Birir has the details for us.
For close to a month now, testing for COVID-19 has become a challenge in various parts of the country thanks to shortage of rapid testing kits. In Kakamega County, for instance, patients have to wait for their results for up to 5 days or more. This has forced the public hospitals to send patients to private hospitals and laboratories, which also reportedly have a shortage.
They are using the PCR to carry out our tests, and you see PCR does not actually do the testing. PCR only you collect the samples and then we take them to KEMRI either at Kisumu or in Busia. The rapid antigen tests kits were exhausted on 3rd July 2021. That's about 3 weeks ago.
The shortage of these rapid testing kits has also led to testing of less samples across the country compared to how it was more than a month ago. This has been attributed to a hitch in movement of kits from warehouses to laboratories.
We've been relying on KEMRI Wellcome Trust in Kilifi, but it's processing samples from the region. So we cannot get as many slots as we are used to for Mombasa County. Averagely, we normally process between 450 to 500 samples for the county. It's also affecting travelers, international travelers and truck drivers who rely on us to process their samples. And averagely, we normally process around 120 samples for the truck drivers alone. So this is affecting us in a very big way.
In a meeting with the Ministry of Health, the World Health Organization has warned of an upsurge of COVID-19 cases in the country, especially if Kenyans continue to attend political gatherings.
If we look back over the last year or so of COVID globally, we have noticed the countries that had very intense political activity ended up with very large surges around that time. And I think one of the most recent examples would be the situation that was seen in India recently, where a very large surge was preceded by very intense political and other activities.
Meanwhile, over the last 24 hours, Kenya has recorded 618 new infections out of a sample size of 5,507. This is a positivity rate of 11.2%. Unfortunately, 17 new deaths from the disease have been recorded, bringing the total number of deaths to 3,800. 1,222 patients are currently admitted in various hospitals across the country, while 4,339 are on home-based care. 139 patients are currently battling for their lives in different ICU facilities. Chebet Birir, KTN News.
The Ginyang livestock markets in conflict-prone Tiat